email it to you after today's presentation. And that is enough of me. I am happy now to turn the reins over to my NCASE colleague, Siobhan Braden. Siobhan.
Thanks, Preeti, and greetings, everybody. On behalf of the National Center on Afterschool and Summer Enrichment, it's my pleasure to welcome you to our webinar today on partnerships and innovations to support the increased need for school-age childcare during the COVID-19 pandemic. I'm Siobhan Braden, and I'm pleased to introduce my colleagues and our additional speakers today. I'm joined by my colleagues, Dr. Katari Coleman and Suzanne Birdsall-Stone, both with NCASE. And then we have three guest speakers today. We have Nicole Vint, who's CCDF Administrator from Nebraska. We have Miranda Gray, who's the Interim Deputy Commissioner of the Child Development Division of Vermont. And we also have Dr. Hollymoorhouse, Executive Director from Vermont Afterschool. And I know you'll really be interested to hear some of the examples that they'll be sharing later in the session. For our agenda today, we're going to talk about the needs of children and families and the priorities for collaboration and partnerships. We'll share our newly released brief, and there's a link to it. Kate's going to post a link to it in the chat for you. We'll also be engaging you throughout the presentation with polls and chat pods because we really want to hear from you what you're doing. We know you're all doing creative and innovative work all across the country. And also, if you're just joining and you haven't had a chance to introduce yourself in the chat, please do take a minute to do so and let us know where you're from and what your role is. It's great to see we have folks from all across the country, from New Jersey, Mississippi, California, Arizona, DC. So it's great to have participants from all across the country. Finally, we'll share, after we'll hear from our state presenters from Vermont and Nebraska. They're going to share about the collaborative work that they've been doing to meet the unique needs of family and children. And I certainly don't need to tell anybody on this call how crucial school-age childcare has become during the pandemic. And finally, we'll share some next steps and some resources about where do we go from here. And as Preeti said, we'll ask for some feedback so we can continue to improve our work. Thanks again for joining us today. I'm now going to pass this over to Katari.
Good afternoon, everyone. I'm Katari Coleman. As introduced earlier, I get the pleasure of being the project director here at NCASE. And I am going to really go over the why for this webinar. I was looking in the chat and noticing that people that are joining are on the programmatic level as well as the state and the federal level. And so I'm sure you're going to hear a lot of information, a lot of ideas that will be helpful today. So why this webinar? Our purpose for this webinar is to emphasize the importance of OST in partnership work, look at touch point areas of need that are affecting children and families, and elevate some state examples from you and our presenters today in order to ground it in our practice. So I'm going to pass this on to my colleague at NCASE, Suzanne, who will take it from there.
Thank you, Katari. This is Suzanne Birdsall-Stone, and hello, everyone. Welcome. To start forming partnerships, we know it is important that we start with what children and families need. This list of factors is the whole school, whole community, whole child framework developed by the CDC, and it helps us think about health and mental health, nutrition, physical activity, and social and emotional climate needs. For example, We know that only 15% of children regularly receiving school meals were receiving them with schools closed. And we know from surveys that mental health needs have risen while access to counselors and social workers at schools has fallen. When state reopening plans were coded, 49 states had guidance for the physical environment. However, 12 states listed nothing on social emotional climate. So it leaves us addressing the question of how to form and to deepen partnerships that address the whole child. The Urban Institute wrote this great brief, Meeting the School-Age Childcare Needs of Working Parents Facing COVID-19 Distance Learning. And there are 3 priorities in collaborations that we want to spotlight. One of them is to help children re-engage and reconnect. We know that inequities that existed before the pandemic have deepened, and we need to make sure children's basic needs are met, and that we place a priority on social emotional learning and trauma-informed practices, given what has been experienced this year. This means being clear and having the data to understand what our children and families want and need, and in the spirit of representing all children and families, keeping in mind as we plan that only 40% of school-age children in care are in centers. The other 60% are in home-based child care, and that 48% of low-income families work non-traditional hours, while only 8% of centers and only a third of family child care homes provide non-traditional hour care. When thinking about the actions needed to accomplish these priorities, we can start with assessing the needs of families. By coordinating data, we then have real-time information on needs, and specifically on supply and demand of out-of-school time. As systems leaders and providers, we need to build connections between school and programs that focus on access to support, including meeting the needs of teachers and caregivers. And we can encourage blending funding and consistent guidance across state agencies to reduce provider struggles in meeting multiple or conflicting sets of guidance. And I think we have a poll for you now. Katari?
Yes, so in this poll, we ask you to indicate the partners that you have been working with to give us an idea of what type of partnerships are happening out there. Take a few minutes for this, a minute or so. Okay. See a great amount of partnerships there with CCDF and licensing, as well as nonprofit family organizations and community-based organizations, as well as faith-based, as well as Department of Education and 21st Century Community Learning Centers. Right, and as well as 50 statewide networks and the local after-school networks and intermediaries, and higher ed. And then there are some with school health providers, therapists, and mentor programs to meet the needs of children and families. So we're going to, I think, close the poll out at this point. Great, thank you. And
oh, great
Suzanne,
representation. Yeah.
I know.
Great representation. Wow. Yeah, every category, there's partnership action happening. That's great. And collaborating and partnerships is not a new topic. But we are in a new time, and in the last year it has taken more effort to address the needs of youth and families and tapping into state and community resources for collaborative partnerships has led to innovations in services. In our practice brief that we are just releasing very recently, partnerships and innovations to support the increased need for school-age childcare during the COVID-19 pandemic, and I think the link for that is in the chat box. We focus on areas of impact related to health and safety, childcare operational costs, hybrid and remote learning, nutrition and SEL, and also provide state examples to illustrate partnerships and innovative approaches that target these areas. So we'll look at each of these areas and then move into some state examples.
Yes. So we're first going to take a look at health and safety. So due to the impact of the pandemic, facilities that are open must contend with guidance from multiple factions, like local health officials, school districts, child care licensing boards and bodies, child care accreditation bodies, and other community partners to determine the most appropriate plan and action for their facility. Some of the general expectations are noted here, like social distancing strategies for groups, modified health screening procedures, like temperature checks and mask wearing. They have unfortunately put an extra burden on operating programs.
This list represents the elevated program needs that have impacted child care operational costs. While there have been some additional funding through the CARES Act and other sources to help meet the additional costs for PPE, technology, and increased hours, this has not been available for all programs and has not covered all children's needs. For example, we know because of the need for lower ratios related to social distancing and space, this has created waiting lists and left parents scrambling for reliable childcare. So the Afterschool Alliance conducted a series of 3 surveys called After School in the Time of COVID. In the 3rd survey, which was released in November of 2020, 1,445 providers representing 7,300 programs responded. The survey showed that at that time, more programs were open, though typically serving half the children they served last year. And 2 in 5 said they can't serve all those who need care and that they have a wait list. They found that children and families with low incomes have less access, and staff are more concerned about their mental health, learning loss, and access to technology.
So children need technology, supervision, and support to successfully navigate the remote learning experience. And issues of equity can further complicate how families and systems navigate new technology expectations. Academic supports and changes to daily activities. Remote learning not only means school systems and educators shift their in-person instruction to an online platform, but it also requires parents and caregivers to become remote learning mentors. Then there are the technological issues, access to tools like computers, netbooks, etc., and the internet. A RAND Corporation survey of teachers found that most teachers, 75%, find students' lack of access to technological tools, and students' lack of access to high-speed internet is a serious obstacle to effective implementation of remote learning. In the same survey, however, many teachers, and it was 59%, report that all or most of their students have access to a computer or tablet to use for schoolwork when they need it. Nearly a third, 30%, report that just some of their students have access. Next slide. So here is a subset of the considerations outlined in the 2020 Urban Institute issue brief. These guiding principles, rooted in policy and planning for distance learning, raise some questions to consider, like how are parents' needs to have quality childcare being considered for children of all ages? How can distance learning strategies prioritize working families facing the greatest risk and inequities? What resources and partnerships are needed to support quality distance learning? What are the challenges we are faced with when it comes to the sustainability and supporting the sustainability of supporting distance learning? Next slide. Another impact of the pandemic, I'm sure some of you may be familiar with, is that 29.4 million children whose families qualify for the National School Lunch Program may experience some level of food insecurity by missing school lunch, and for some, even breakfast. As we all know, nutrition is key to brain development, and this deficiency can greatly impede all aspects of development. Information about this issue can be found in Feeding America, the impact of the coronavirus on child food insecurity. On this slide, you have some of the general observations here and outcomes that have happened with regards to food insecurity across the nation.
So now social and emotional learning, which is a big topic. And as CASEL states, the research documenting the impact of SEL is compelling. More than 2 decades of research from multiple fields and sources demonstrates that education promoting social and emotional learning does get results. What we also know is that hybrid and remote learning depart from the average child's normal learning process and create concerns about social and emotional development. Children thrive on relationships with peers and community engagement. A decrease or a lack of in-person interaction may affect their social and emotional development and ultimately impact all the areas listed here, which are positive outcomes from social and emotional development.
And I'm going to turn this over to Suzanne as she gets to move on to the second part that includes our presenters.
Great, thank you. Yeah, this is going to be great. So the brief highlights several states that are using partnerships and innovations to support out-of-school time programs. And we're fortunate to have 2 of the states featured in the brief join us to highlight the power of these state-level collaborative relationships to target some of the areas that we've been discussing this afternoon. And so to start us off from Vermont, our Hollymoorhouse, the Executive Director from Vermont Afterschool, as Siobhan shared with you, and Miranda Gray, Interim Deputy Commissioner from the Child Development Division. Welcome to you both, and thank you so much for being here.
Thank you so much, Suzanne. This is Miranda Gray, and I'm going to start us off, and then we'll kick it over to Holly. So in the late summer, it was about mid-August, our governor directed $6.9 million of COVID relief funds to be able to help support families and children as we learned that schools' reopening plans would vary. We, in the Child Development Division, partnered with Vermont Afterschool to come up with what we named the School Age Hub Project. So the concept behind this was to provide grants to sites that would provide school-age care on remote learning days. So as I'm sure as in many other states, we had a variety of reopening plans by schools, some that had kids fully remote, others that would bring in kids in a hybrid model, and then also some schools that would have children come in for a shortened day. So one of the key pieces here is that these grants were for providers that would be providing care for a child that was out of school a full day. So those schools that had a shortened day
didn't have this resource necessarily. The grants provided money for startup costs as well as the first month's operating expenses. So we helped providers be able to buy games, pencils, crayons, books, everything that they needed to be able to support these children both academically and then with enrichment activities. We also supported the use of technology, so we had some schools that were able to provide their students Chromebooks, but we had others that did not, and so it was critical that these hubs were able to have the children that attended be able to connect to their online learning. So that was another thing that we supported. We also worked, and I should say Vermont After School led a staffing campaign, so it was really important for us to not destabilize the child care network that was already out there. We didn't want staff leaving their existing programs to come into the hubs, so we worked really thoughtfully to be able to recruit into this program. And we also had to ensure that we could have Wi-Fi at all of these hubs. In just a few weeks, that resulted in us having 43 hub sites, and some of the hubs had multiple locations, so we had 93 sites, and we served approximately 6,000 children. Next slide, please, and I'll turn this over to Holly.
Thanks, Miranda. So I'm Hollymoorhouse with Vermont After School. We are the statewide after-school network, and shout out to my fellow network colleagues out there on the call. I want to hit on a few key points about what worked well. I have, through the network, partnered with state agencies in Vermont for over a decade, really closely in a lot of different ways. But I will say that this project brought that partnership to a whole nother level. You know, something that I just hadn't experienced and hadn't anticipated. But the need was so great. The crisis for children and for families was in front of us, and the effort had the full weight of the leadership in Vermont. You know, that partnership with Miranda and her team, you know, was multiple conversations every day, you know, 6 a.m., 10 at night. It was daily standing meetings. It was being able to reach out and get quick answers to every issue and, you know, complication that came before us in order to move quickly and set up these hubs in order to meet what we were seeing in the communities and to always be responding to the changing needs and schedules. Another huge part of the partnership, you know, was the partnership across agency. The Department of Health was, you know, on field calls with us every week and modifying guidance and had an on-call line that program providers could call and get individual support on specific situations. We were collecting questions from the field, and they were answering every single one of them to make sure people had the information they needed to be able to figure out pods and groupings and safety measures and cleaning and staffing concerns and so forth. We also saw, you know, partnerships around licensing and fire safety in order to get buildings set up and so forth. We saw the Department of Labor in Vermont really helped us on that staffing campaign that Miranda mentioned. So this was, you know, one of the biggest concerns for pods were finding staff to work in them. And so we had never done this before in Vermont, but we set up, it was a statewide campaign, and we had YouTube videos of people working in programs, and you know, we went out through all kinds of social media channels to attract young college students that might be home in Vermont in the fall, and people who were, you know, changing jobs or unemployed and looking for a new career start. And we collected inquiries at the network across the state, and then distributed those out to the hub locations on a regional basis so they could see what kind of inquiries and interest had come in, and then they could reach out for candidates. And about half the candidates that we attracted through that recruitment process ended up being hired by the hubs. So it was a major effort. And as Courtney mentioned, you know, the other piece of that staffing effort was finding staff, but then also quickly training staff. So we had a boot camp set up. We had lots of SEL training. We had ongoing coaching from network staff reaching out to the hub providers on a regular basis to meet their needs and see what help we could provide. I think the other big piece, other sort of what worked well, was looking at this effort as not starting up something new from scratch, but really looking at that existing network of child care providers, licensed programs, and after-school programs, and using that as the basis to build this entire system. You know, they already had relationships with children and families, in many cases with schools, and we wanted to make sure at the end of this time that we had actually strengthened, right, our network as a whole. Our governor has a goal for universal access to after school in Vermont, and we really saw this as an opportunity to make that a closer possibility, rather than, as Miranda said, you know, detract from one set of programs to set up a different set of programs. Can you go to the next slide? And I think I'll pass back to Miranda to start sort of the reflections on lesson learned.
Thanks, Holly. So one of the very quick lessons that we learned, although we were able to make all of the programs be able to access CCSAP, there are a number of families that weren't eligible for this assistance, and so we heard very loudly and quickly from families that, you know, they hadn't budgeted for this expense, and so this was it was a large challenge for them, and even more so nuanced. Some of our hubs were inside of school buildings, and so that was, you know, awkward for families at times, where they were dropping off their kids where they would normally go, but now they were paying for that care. There was also there was a lot of disparity in the education, you know, of what children were, how long kids were connected to school. So some kids had Zoom meetings for a good portion of their day. Other kids, you know, had a packet of work that maybe they had to do and that lasted an hour. So that was a struggle too, and something that we heard from our school-age hubs that was a little bit hard to navigate, particularly if they had a wide range of children. I should have mentioned earlier that this was open for kindergarten through sixth grade. And then some of our hubs were also serving multiple, in addition to multiple age groups, they were serving multiple schools. So there was really a wide range of education going on, which was could be challenging to navigate. And I think I will pass this back to Holly now.
Thanks, Miranda. Timing, right, for all of us across the whole nation through COVID, it does feel like you're always trying to respond to something that you wish you had started working on 2 months before. You know, we did run into that with the hubs. If it took a center or provider, you know, if they needed to set up a new space or a new room, sometimes by the time we could move forward on that, families had to find other care and make other choices. So we were always trying to fight the clock throughout this. The other thing that was a little bit unexpected or surprise is we had a lot of inquiry up front from businesses wanting to have hubs on site for the children of their employees, including a number of hospitals were really interested and so forth. But when it really came down to walking through that process of what it would look like, what we found out is in many cases maybe they had a space or a room, but they really did not want to run the program themselves. They weren't looking to start a child care or an after-school program or a hub program. They were really wanting it but not wanting to run it. So some of that we could address by helping to create some local partnerships where one place had a room and another place could run the program, and help those partnerships form locally. In other cases, we ended up recommending, the employer partner with a hub at another location and move things on there. One of the other challenges that we ran into is there's a lot of variety in our state about how the schools were reopening or not reopening, and some schools were really reluctant to even let their buildings be used for the child care hubs on remote learning days. And those were often the places where, because they were mostly remote, families needed the most support. So we found that some of the most challenging areas were the areas with the fewest resources. That was, a challenge throughout the time. And I think we'll wrap up there and hand back to Suzanne.
Well, thank you so much, both of you. I think that one of the real highlights of what you've talked about is that these were pre-existing partnerships that had to deepen quickly and problem solve together and bring you to a whole new place. So, like, it just brings us back to the importance of partnerships being in place in order to meet the needs of families and children. So, beautiful work. And I wonder what questions you might have. And if you could put a question or two in the chat, we have just about a minute to have Vermont answer anything that you're curious about. And we've got a question coming in from Diane Genko.
Suzanne, while Diane's typing, I want to pick up on what you said because we know there are inequities in our system and disparity across our landscape, right, about what children and families have access to from one community to the next. It was really hard in places in Vermont that didn't already have an existing after-school program or licensed child care program in COVID to set something up. And it was so much easier to get something going and expand to the remote learning days when they already had a partner there. So I think a lot of concern that we have had is about, you know, not seeing those disparities just get greater and greater.
Right.
I think it's some of the conversations we're continuing to have in our state.
Yeah, and that's a really critical one. I think that that got highlighted during COVID too. Here's a question from Diane, and I think we just have time for one before we hear from Nebraska. So Diane asks, how did you handle the fear factor? New Jersey has had 22,798 deaths. Vermont has had 201 deaths. Families are afraid in areas like Newark where 36,000 kids have not been in school one day.
So Diane, I know our scale is really different than yours, and you all were ahead of us in the COVID journey with cases as well. You know, we have, I keep thinking of Dr. Brina Holmes, who has been leading the effort of supporting child care programs and after-school programs through COVID. She's a former pediatrician and has this wonderful, calm voice and would literally be on the phone with providers answering every single question as long as it took. And so many times I experienced, you know, providers, a state call with over 100 folks, you know, really, really nervous. And as they heard the science and they walked through the guidelines and had their questions answered, you could just feel the stress level going down. So I guess it's like that personality. It's a lot of conversation. It's having that helpline. We also had some early leaders who worked with the guidelines, worked very closely with the Department of Health, up and running in the summer, who filmed what they were doing, and having that video of that it was possible, and this is what it looks like with the spacing and the masks and the safety check-ins and all those pieces. That video kind of went viral around our state and really helping people work with staff and really talk through what it could look like. So those are the two things. I know that doesn't completely answer your question about fear because the fear is real, but those were a couple of things that helped in Vermont.
Well, I think that that these are the kinds of conversations that have legs, right, that you could spend a long time talking through. So so maybe there's more conversation to be had. And helpful, Diane says helpful. So thank you so much, Holly and Miranda. I'm so glad that you are here. Now we have Nicole Vint, who's joining us from Nebraska. She's the CCDF administrator at the Nebraska Department of Health and Human Services. Hello, Nicole.
Hello, and thank you for this opportunity. In Nebraska, when we received our CARES Act funding, we earmarked about 20% of our total funds for school-age, after-school, and summer supports and initiatives. At the time of planning in the spring of 2020, all of our Nebraska schools were closed. These closures impacted all of our before and after-school programs that operated within our school buildings and several summer programs. So the department, our CCDF program, has a very good collaborative relationship with our state's after-school network called Beyond School Bells. Beyond School Bells, as this website here on the presentation shows, Beyond School Bells is one of several child, family, provider-focused initiatives administered out of our Nebraska Children Family Foundation, which is a private entity. The department partnered with Nebraska Children's to administer CARES Act funding opportunities for our licensed child care providers, as well as CARES Act funding opportunities for our center-based program serving school-aged only children. Our providers had two funding opportunities that they could apply for. One was the stabilization fund. This provided a grant payment of $5,550. These funds were intended to provide relief to child care providers, the financial burdens caused by the pandemic, and to help with their operational expenses. The other funding opportunity we offered was the incentive to reopen. We had $3,000 earmarked for these grant opportunities, and these funds were intended to help support providers with the costs and expenses associated with reopening their program. Again, several programs were closed due to COVID for the end of the school year for 2020, as well as the summer months. With the incentive to reopen, providers, once awarded, were expected to reopen and start operating within 30 days. For both of these funding opportunities, we do require that the providers or the programs be in good standing with their state license, as well as their child care subsidy agreement if they had one. For these, we took a reimbursement approach with funding our providers. This really was to ensure that we had all of the documentation we would need for any future audits. After submitting an online application, programs needed to provide documentation of allowable expenses, such as utility payments, facility rent or mortgage payments, staff salary, cleaning supplies, personal protective gear. We accepted receipts, photocopies, pictures, text messages from cell phones or emails of pictures of receipts. Really wanted to be flexible with helping them get that documentation. Once all documentation was received and approved, we issued payments out to child care providers or our school-age providers. Our state declared a state of emergency on March 13th due to the pandemic, and these funding opportunities, we have allowed expenses to date back to March 13th. So what we really found is that most providers at the time of application already had documentation that they could submit, and also for tax purposes or for bookkeeping purposes, this information was readily available for the providers. So to date, over 70% of our licensed and school-based programs serving school-aged only children have applied for this funding opportunity, which equates to about $1.4 million. About 90% of the providers went for that stabilization fund, and 10% went for the incentive to reopen fund. We did a lot of outreach. We have our websites. We first sent a joint letter from the department and Nebraska Children's Family Foundation to all of those providers who would be eligible for this opportunity. We followed up with a postcard a few months down the road. We've advertised it in various newsletters. Beyond School Bells has a monthly newsletter that they highlight all of their work. So it's still linked in there. And then we've even cold called providers that we know have not applied that could still be eligible.
We're keeping this funding opportunity open for a few more weeks, and then we'll reassess if we have any funds left over and possibly do a secondary payment out to these providers. In addition to the stabilization and incentive to reopen funding opportunity, Beyond School Bells is also using CARES Act funds that we've contracted with them for a few other statewide initiatives. One of them is for school-age care staffing and support expansion. It's to develop online and in-person opportunities to engage high school students and college students to help provide adequate staffing to after-school and summer programs. We know that with various directive health measures counties have imposed in across the state, group size, we have group size restrictions, and so this is really to help get that adequate staffing. We also, with some of our shutdowns that we've seen across the state, just swimming pools didn't open last summer, movie theaters, various places where your typical high school student or college student might have a summer job or a part-time job. This also helps get them involved and engaged and in employment. We're working here with our universities, extension, honors, and STEM programs to really engage and work with those high school and college students. We're also strengthening public networks to help support school-age care. We're working to expand community-specific school-age networks by strengthening those collaborations between providers and then city and county government or private and nonprofit entities to expand options. We experienced with the schools closed last summer, it affected our summer programs that operated typically out of those schools. So some of them were able to find an alternative location to operate, some were not. So this will help just plan in the future to have alternatives for these programs to operate out of. And Beyond School Bells is doing a fabulous job working in our metro, our larger communities, as well as rural communities, and even with our tribal communities in Nebraska. We've also, or Beyond School Bells is also working on professional development piece just to ensure that providers and programs continue professional growth and development during the periods that are impacted by the pandemic. Professional development is more online now, where it previously was in person, but we want to make sure that there's those opportunities and supports for school-age focused development. And then lastly, I just want to note that besides the partnership we have with Beyond School Bells and the funding opportunities and initiatives that they're leading, the department also supported school-age children by changing our child care subsidy authorizations to full-time care for the months of March, April, May, and even the beginning of June, when typically school was in session and the typical school-age child attended before and after school and non-school days. So they now have the opportunity to attend their child care program full-time. And then we've also, as school started back up this fall, as Vermont mentioned, it looked different across our state too. Some schools opened full-time in person, sometimes when some schools went 100% remote, some were part-time remote, part-time in person. We had rotating schedules. So the department has allowed child care subsidy providers caring for children who are also assisting in remote learning the ability to bill for child care subsidy. Suzanne, I can turn it back over to you.
Great, thank you, Nicole. Really broad reach and really deep relationship, and also there's an awareness of need and an awareness of what's going on in the state, and knowing where to cold call, you know, where to let people know what's open and available for them so that they can serve the children in their communities. So like, that's beautiful work. It looks like we have a question coming in from Edith Hildebrand. So let's see what that is. do you have a sample of your grant application process? If so, are you able to email?
I can see if I can extract it to PDF form. Otherwise, and I can do that and send it. Otherwise, you can go to our website and navigate through it. It takes about 10 minutes to complete or to be able to see what questions are being asked.
Nicole, would you like to put your website in the chat box, and then Edith can follow up?
Yes, and when you get to the website, it will look identical to what is on the screen right here. And we have on the upper top right, it says Child Care Providers COVID-19 information, and that hubs all of our information, not only for the school-age specific grants, but we also had grant opportunities very similar to our child care providers across the state.
And thank you for our presenters sharing what they've experienced at this time. We want to quickly, just in looking at the power of partnerships, we just want to quickly say that Karen Pittman, I don't know if you guys know her, but from the Forum of Youth Investment, she talks about softening of the walls. And some of that happened this year during the pandemic, where schools and OST worked more closely together, and the potential for more merging in the future. And so all the things that we talked about, whether it was remote learning or nutrition or social and emotional learning, all the needs that came up during this time, we know that these are some of the things that you can think about as you move forward with regards to developing partnerships or strengthening partnerships. Summer programming, OST program redesign, policies and procedures, and addressing equity gaps, which was mentioned throughout our presentation. Of course, funding and resources, social emotional supports, and mental health services. And so just giving you some food for thought here as you move forward, as states move forward, programs move forward. And now I am going to turn it over to our host, MC Siobhan.
Thanks, Katari, and thanks everybody for your participation today, for your thoughtful questions, for sharing examples, and super thanks to our presenters from Vermont and Nebraska sharing their partnership strategies and their innovative thinking. And it really is clear how some of these partnerships and activities and strategies that were adopted during the pandemic are going to lead to longer-term sustainability. And that's very exciting because we have opportunities to strengthen and adjust our systems. So before we wrap up, I'd just like to quickly make you aware, if you're not already, of our resource library, which has a number of out-of-school time resources on a variety of topics. The slides are available at the bottom of the screen, and they'll also be emailed to you, and it will be recorded. And finally, we'd really appreciate you taking a couple of minutes to give us feedback after today's event so that we can continue to plan for future webinars. And at the very end of the presentation, there are some resources which I don't have time to review today. Many of them were shared during the presentation, the reports that we referenced. But again, you'll have the links in the presentation. So thank you so much and have a great rest of your day. Goodbye.